All right. Meeting call to order.
Thank you. I request President Rotarian PHF Ritika Gupta to confirm the minutes of the previous meeting.
The minutes of the previous meeting were circulated on our group and no queries or questions have been asked or raised regarding the same. Thereby, the minutes of the previous meeting stand confirmed.
Thank you, President. Good evening, fellow Rotarians and viewers. Today we have a very important topic, that is liver transplant, which is a medical miracle. And we have a very important and eminent doctor today with us to speak on the subject, Dr. Hardik Shah. I request Rotarian Dr. Kamal Jain to please give the introduction of our guest today. Thank you.
Good evening, dear Rotarians. Today we have with us Dr. Hardik R. Shah. He is a senior consultant in liver diseases unit, liver transplant unit, acute liver failure unit at Nanavati Max Institute of Liver, Intestine and Pancreas Sciences, Nanavati Max Super Speciality Hospital, Mumbai. Dr. Hardik R. Shah is a distinguished hepatologist and gastroenterologist with extensive expertise in liver diseases, liver transplantation, and therapeutic endoscopy. He currently serves as a senior consultant at prestigious Nanavati Max Super Speciality Hospital. Dr. Shah brings comprehensive experience in managing complex liver conditions and has dedicated his career to advancing patient care in hepatology. Dr. Shah's academic foundation includes an MBBS from MGM College at Kamote, Navi Mumbai, followed by specialized training in including a DNB in internal medicine from Max Super Speciality Hospital, Delhi NCR, and a DRNB in gastroenterology from Fortis Hospital, Mumbai. He has further enhanced his expertise through a fellowship in hepatology and liver transplant at Green Angels Hospital, Mumbai, and specialized training in therapeutic endoscopy. Dr. Shah's clinical practice encompasses of a comprehensive range of liver and pancreatobiliary conditions. His area of specializations include liver diseases management of chronic liver diseases, liver cirrhosis complications, acute liver failure, and acute on chronic liver failure. He has particularly expertise in viral hepatitis, fatty liver diseases, alcoholic liver diseases, and autoimmune liver conditions. In liver transplantation, pre and post liver transplant management, providing critical care throughout the transplant journey. In oncology, he specialized in taking care of hepatocellular cancer, that is called as HCC, and pancreatobiliary malignancies. In therapeutic procedures, he does advanced diagnostic and therapeutic endoscopies, including ERCP. Dr. Shah has built his career through progressive roles at leading healthcare institutions across Mumbai and NCR. His journey includes positions at Green Angels Hospital, Parel, Thane, Institute of Gastroenterology, Sir H.N. Reliance Foundation Hospital, and Max Super Speciality Hospital, among others. This diverse experience has provided him with the exposure to varied patient populations and complex clinical scenarios. Dr. Shah is actively engaged in medical research and has co-authored numerous publications in national and international journals, contributing to the advancement of knowledge in hepatology and gastroenterology. In his current position at Nanavati Max Super Speciality Hospital, Dr. Shah leads the management of patients with complex liver conditions, coordinates liver transplant care, and manages acute liver failure cases. His role is in both clinical care and academic responsibilities, making him a valuable asset to the institution's liver science program. We welcome Dr. Hardik R. Shah.
Thank you, Dr. Kamal Jain. Over to you, Dr. Hardik Shah.
Thank you very much for the kind and brief introduction. It's my pleasure to be here. And am I audible?
Yes.
It's my pleasure and privilege for getting this opportunity. So I'm sharing my screen. Let me know once been able to see my slides.
Yes, we are able to.
Okay. So today's topic is very interesting. It's about liver transplantation, which has been talk of the decade. It is so called as a medical miracle because until 2 decades back, we were struggling to have liver transplantation or organ transplantation in India. But with advances in science, technology, and with more skills coming in, we've been able to achieve remarkable success in liver transplantation and likewise in other organ transplantation. So I bring greetings from Nanavati Max Hospital. So today's topic and my presentation is going to be on liver transplantation, and I'm going to take you through the basics of liver transplantation, the entire process. I have no disclosures or any conflicts of interest. So before we start off about transplant, let's just understand how and what our liver is and where our liver is. So many times I do come across people, patients talking about liver, but they don't understand where the liver is placed in the body. So we all know where our heart and stomach is. So liver is an organ which is placed in the right upper side of our abdomen. It is just below our rib cage. Why do we talk about liver? Well, liver is the workhouse in the body. It works 24/7, aiding digestion to detoxification. We come across patients asking about detox medicines, detox pills, detox therapies. My simple answer to them is you take care of your liver, you protect your liver, don't trigger your liver, don't upset your liver. It will take care of all the detox process. So this is how and why liver is a very important organ in the body because it neutralizes bacteria, neutralizes toxins, it helps you digest well, it helps you preserve energy, it helps all the metabolic demands and processes in the body to function smoothly so that we have a daily healthy routine life. How do we know that we have liver disease? Well, these days we all have full body packages where liver function or liver profile is an integral part of the tests that are involved. And of course, we do always a screening ultrasound before we go to the doctors. So amongst the liver function test, all these values that we are seeing on the screen, any deviation from the normal range would indicate some liver anomaly or abnormality, which we need to address, and it is best done by a physician or a liver specialist. As proud Indians, we should be knowing the history of liver transplant in India. As we can see that in 1994, the Parliament passed the Transplantation of Human Organs Act, and we were able to successfully do a diseased donor liver transplant and subsequently a living donor liver transplant in 1998. Dr. Soin and Dr. Rajshekhar were the pioneers to start off and do these living donor liver transplants and diseased donor liver transplants in India. Well, subsequently, from 99 to 2005, many other states started taking up this living donor liver transplant and started having this organ listing protocol so that we were able to achieve a cadaver list in most of the states. In 2014-15, there was establishment of notos and sotos for various states, wherein every living donor liver transplant, or rather all the organ donor transplants, were being regularized and authorized so that any illegal transplants or organ claims were being called off. Well, it's very proud for us to know that India ranks third globally for overall liver transplants following US and China. India ranks first globally for living donor liver transplants, where other countries are actually kind of imbibing strategies and surgical skills from Indian surgeons to inculcate in their transplant practices. India has been able to achieve more than 180 transplant centers, and the number keeps increasing, because of which we are doing almost near around 4,000 liver transplant per year, of which maximum transplants are living donor liver transplants. So liver, as we say, is a privileged and a blessed organ. Now, why is this so? It's mainly because of two characteristics that the liver holds. First is the reserve. Now, when we talk about reserve, liver has tremendous reserve potential. What does it mean? It means that at a given point of
472 का जेट
a
उठा
healthy liver
472
will be able to function only for 30 to 40%, but still reach out to the 100% metabolic demands of the body. What does it mean? It means that if 50 to 60% of the liver is given out, still the remaining 30 to 40% of the liver will function to its capacity to reach out the entire metabolic demands of the body. Well, this forms the basic principle of a living donor liver transplant. Coming to the second characteristic, the regeneration potential. A healthy liver has a miraculous potential to regenerate and improve on its own, which forms the basis of the course post-transplant, which means that after a liver transplant, the healthy liver tries to regrow and regenerate to its maximum potential, leading on to almost a normal size liver. Well, this is what we call it as a miracle. God has been kind. God has blessed the liver and given these two tremendous characteristics, because of which liver transplant has been able to be successful. So what are the types, as we just discussed? Living donor liver transplant and disease donor liver transplant. Well, a simple comparison between the two. When we talk about disease donor liver transplant, it is mainly organ from a brain dead donor, where the family decides to donate organs. These are allocated to the patients who are on the wait list. Well, when we talk about the wait list, the time on the wait list could be more than 6 months. It can take a year, it can take 2 years. The organ quality may be an elderly donor, maybe a young donor, we would not know. This is usually preferred when we do not have a living donor in the family and probably the disease is stable and the patients can wait on the list. Now, when we talk about living donor, which has been kind of the maximum number of transplants in India that's happening in present day era, somebody from the family is able to donate part of the liver, because of which we can time the transplant. Well, this is very essential when we do not have time and we have to plan the transplant at the earliest. So this helps especially in an acute liver failure setting, maybe in patients who are sick and are struggling and suffering because of complications of the liver disease, and just the wait is not being able to be possible. So when does a patient require a liver transplant? Very simple. When you are suffering from an irreversible and an irreparable damage to the liver, a new liver has to take over. These conditions are especially when you have a setting of acute liver failure, when there is an end-stage liver disease, because of which there are multiple life-threatening complications, when there is liver malignancy in the form of hepatocellular carcinoma, or in pediatric cases, there are some hereditary or genetic diseases. So let's take you through few case scenarios where we will be able to understand the implication and the seriousness of liver transplant in these various settings. So the first case is of acute liver failure. This was about a 24-year-old female, young female. She had jaundice. She was being treated at home. Somehow the parents found her to be drowsy, sleeping a lot, irritable. So she got admitted. When we saw her, her lab parameters were grossly abnormal, bilirubin of 7. The liver enzymes were sky high. PTINR, which is an indicator of liver synthetic function, was abnormally high. The ammonia, which is the toxin liver is able to metabolize and neutralize, was scaling high. She was found to have hepatitis A infection. Now, many times this infection is self-limiting. Body tries to clear off the virus and patients do sail through. But despite giving her the medical treatment, we saw her deteriorating and she required a 24 hours dialysis. She was having an altered sensorium. She was going more drowsy. So we had to put her on a ventilator and the lab parameters kept on worsening. So then we had to discuss prospects for an urgent transplant. In this case, the father, who was of around 50 years of age, same blood group, he agreed to donate part of his liver. We made him undergo rigorous detailed workup overnight for the fitness before a transplant. There were legal formalities that could happen, and we could start the transplant as early as possible within 24 hours. Thankfully, the transplant went successful and we could discharge the patient by around 2 weeks of hospitalization. So this shows that if there is a real life emergency where liver is failing, liver transplant can happen. There are discussions required with the family. A volunteer donor is required. Finances are, of course, important. There are legal formalities which are important. And the entire process can happen overnight. We could be able to do everything required as per protocol within a good 12 to 14 hours and save the child. Second case of liver cirrhosis, where there is an end-stage liver disease and multiple complications a patient bears. This is about a 48-year-old businessman, a very well-to-do, but significant alcohol consumption, alcoholic, taking significant amount of alcohol every day for almost a decade long. He developed jaundice and abdominal distension. So he had developed fluid in the tummy. There was swelling on the legs. So he decided to give up alcohol. We put him on some medications, but on a periodic assessment, we found that his jaundice was worsening. There was significant amount of loss of weight, appetite. There was profound weakness. He was unable to get out of the bed. He required frequent sessions of fluid removal from the abdomen, making his life miserable. We did list him for a cadaveric liver transplant, but in due course, he also experienced a blood and vomiting. This was very life-threatening. We had to bring him back to the hospital. We had to do urgent endoscopy and try to control the bleeding. Considering the multiple complications he was going through, we discussed the prospects for living donor liver transplant, where the wife agreed. She was of the same blood group. We made her go through all the protocol-based investigations and the legal formalities got completed. Once we got the clearance, liver transplant did take place, and now the patient is doing very well. Rather, he has initiated this alcohol anonymous meetings in his locality so that he can inspire others to give up alcohol and remain sober. Third case of liver malignancy. This is about a 64-year-old female, long-standing diabetes, obesity, weight usually around 90 kgs, thyroid issues, some cholesterol issues. She knew that she had fatty liver. Maybe 7-8 years back, she had done some ultrasound. She was advised to lose weight, but she was unable to. This is a typical case scenario that we come across in today's population. She just underwent a routine checkup recently because she felt that she was feeling bloated. On ultrasound, to everyone's surprise, she found that her liver was small and shrunken, and there were 2 liver tumors that were seen. And all these while she was just without any symptoms. There were changes of liver cirrhosis and the tumor markers were positive. So after a detailed discussion with the family, a prospect for donor was found because the son had agreed. And then we went ahead for the living donor liver transplant in her. And with needful clearance after 3 weeks, we were able to do a successful living donor liver transplant. And post-transplant, she remains steady without any cancer recurrence. So this has been how liver transplants been changing life, and it has been able to bring a paradigm shift in what we could not achieve in the past in the form of liver complications or liver failure or end-stage liver diseases. So when we talk about liver transplant, the donor is of paramount importance. So who can be a potential donor? Well, matching blood group or universal donor. So a person having O blood group is what we need. Number one. The positive or the negative RH status does not matter in liver transplant. We usually prefer a young healthy donor because healthy the liver, better chance of reserve and regeneration. It should be a family member. India has not legalized non-related donation as of now. The family member could be a first degree, second degree, or a third degree relative. It is a mandatory protocol that the DNA should match before the legal clearances are given. Patient should be healthy, should not be overweight, should have a controlled diabetes and blood pressure, and should not be suffering of any active infection during the time of transplant. Why this is important? Because more you are overweight, more you are fatty, more you have uncontrolled diabetes, more fatty is your liver, and a fatty liver does not have a potential for a good reserve or a good regeneration capacity. Ultimately, patient should be in a sound physical and mental health and should be willingly volunteering for a donation. So how do we go about when we talk about living donor liver transplant? Safety of the donors is very important. It is the foundation of living donor liver transplant because if at any stage or step the safety of the donor is compromised or being affected, we reject the donor. So we usually assess the donor in 3 phases. Phase 1 is the basic blood test. We do viral markers, we do the metabolic profile and just check if the patient is kind of suiting in and fitting in to move on to the second phase. In phase 2, we do all about CT scans, radiological imaging, MRIs for assessing the donor anatomy because that's important for the technical aspects for the surgeons to understand if the anatomy favors a safe liver transplant. Of course, volumes are very important as we spoke that when we ask the donor to donate, we talk about removing around 50 to 60% of the volume of the existing liver, which means that the donor will be left with 35 to 40% of liver for it to regenerate. When the phase 2 is done and we are sure that donor is fit enough, the phase 3 is very important when we talk about a detailed cardiopulmonary fit test. Donor should be able to tolerate the liver transplant surgery provided patient is fit from the cardiac and the pulmonary perspective. So there is an anesthesia fitness. We also let the donor go through a detailed psychiatric and a psychological counseling to ensure that donor is in the right frame of mind before going ahead with the donation. And of course, the ID specialists are very important to ensure that there is no lingering infection that can affect the outcomes of a successful liver transplant. Of course, we talk about donor safety, but we also assess the recipient prior liver transplant. So we know that the liver has failed and we are going to change the liver, but likewise, the cardiopulmonary fitness is very important for the recipient also to tolerate the liver transplant surgery. At the time of surgery, we ensure that there is no ongoing active infection, and we also ensure that there is no ongoing any non-liver malignancy in the body that can have detrimental effect post-transplant. How do we go about with the surgery? These are common questions that are asked. So usually or traditionally or conventionally, the surgery used to be of a reverse L incision. So if you can see the side of the open surgery, you can see the scar mark, which is a formation of a L shape, which is a river L shape. But since past couple of years, there has been an advent and shift towards robotic surgery, which has kind of improvised the prospects of donor hepatectomy. Because with robotic surgery, we've been able to achieve almost a near scarless surgery because the scar marks are not this big and the recovery period is quick with very limited pain post surgery. So now we are preferring and we are fortunate that many centers in India have got their skills developed with robots, which has led on to a cutting edge improvement in offering donor hepatectomy at the time of liver transplant. So as we discussed, the advantage of robotic surgery, no big cuts, there is less pain, there is a faster recovery, there is a preference by mainly the females, especially who are unmarried, because the scar is negligible. And of course, with this robotic surgery, you can resume work early. So, how is the life of donors after liver donation? There are multiple queries and concerns and questions which are always put across. Well, let me take this opportunity and clarify all the myths that we used to believe. Donor is usually discharged from the hospital by 5 to 7 days. There is liver regeneration to almost a normal size liver by around 2 months. There is no restriction of any kind of food or activity for the liver donors except for lifting weights, which goes without saying after any major surgery. Donors can resume work by around end of 2 to 3 weeks after adequate rest has been taken. Of course, they can pursue any profession. We've had donors who are actually pilots now. We have donors who are athletes as well, and they are doing well in their field. Donors can resume gym and exercise after 3 months. Females can plan pregnancy after 6 months of donation. There is no regular, routine, lifelong medication for donors, and the visits are usually in the first month just to ensure that they are doing steady. And once they are back to their routine, they are as good as normal human beings who have donated. How is the life after transplant for recipients? Well, they have got a new lease of life and they have ray of hope to stay more with their loved ones. So recipients usually have a stay of around 2 weeks in the hospital. They have a standard immunosuppression protocol which needs to be followed so that the liver is not rejected from the body. Stitches are usually removed by the end of 3 weeks. We do ask them to follow up every 3 days to 7 days initially, just to ensure that their blood tests are fine, the levels are fine, the liver functions are improving. And likewise, once they are doing steady, we can always ask them to follow up every 2 weekly to 1 monthly. They require adequate rest. They require home cooked food. They need to be avoiding exposure. So markets and buses and public places are the areas they need to avoid, because any person having any respiratory illness or cough and cold can transmit infection to them, which may not be kind of the milder variant in the recipients. There is no strict isolation required. We always get this question that after liver transplant, they will have to face isolation as if they will have to be confined in a jail made in the house. No, they just need to be in the house to rest initially and avoid any exposure from the crowd around, so that they don't contract infection in the initial few months, which are crucial in their recovery. Of course, the premises needs to be well sanitized and hygiene is required. They should be wearing masks most of the times or at all times to avoid any cross infection from caretakers, family members around, or people around. We have been able to break boundaries in liver transplant, and how has that been possible? So, as we discussed previously, liver transplant has been mainly amongst same blood group or O blood group. Now, with strict protocols in selected patients, we are being able to achieve ABO mismatch transplants. What does it mean? That a donor of blood group B can donate to a recipient of blood group A or vice versa. And we have been able to achieve success rates in this kind of transplants. Yes, the protocol is very strict. Guidelines are to be followed as per international protocols, but results have been quite promising. And with this, we have been able to expand the horizons for liver transplant. Likewise, let's say we have people on the waiting list, but they don't have the same blood group. We do take up these pairs, and it has been legally approved that two pairs of which one partner can donate to the other partner of the opposite pair, and there can be a mutual swap. Now, as we always talk, what are the challenges we are facing in liver transplant? Are there technical challenges? No, it is mainly the shortage of organ donation, which has been the discussion every time. Indians' organ donation rate has been amongst one of the lowest in the world in past 2 decades. With the growing population, we have still not been able to achieve adequate organ donation, and this remains an area of concern. This was taken from the initial 2000 time when the statistics were made, and this is very interesting and as an eye opener to all of us, that with the growing population, if even we go up by 1 to 4 million donations, the number of organ donations will increase tremendously and substantially. So we should definitely think about organ donation, discuss with our family, and should be willing at all the times. Let me just read out a very inspirational essay written in 1970s or 80s, which has been kind of motivational for promoting liver transplant and likewise organ transplant. The day will come when my body will lie upon a white sheet, neatly tucked under four corners of a mattress located in a hospital, busily occupied with the living and the dying. At a certain moment, a doctor will determine that my brain has ceased to function and that for all intents and purposes, my life has stopped. When that happens, do not attempt to artificial life into my body by the use of a machine. And don't call this my deathbed. Let it be called the bed of life, and let my body be taken from it to help others lead fuller lives. Give my sight to the man who has never seen a sunrise, a baby's face, or love in the eyes of a woman. Give my heart to a person whose own heart has caused nothing but endless days of pain. Give my blood to the teenager who has pulled from the wreckage of his car so that he might live to his grandchildren play. Give my kidneys to one who depends on a machine to exist from week to week. Take my bones, every muscle, every fiber and nerve in my body and find a way to make a crippled child walk. Explore every corner of my brain, take my cells if necessary and let them grow so that someday a speechless boy will shout at the crack of a bat and a deaf girl will hear the sound of rain against her window. Burn what is left of me and scatter the ashes to the wind to help the flowers grow. If you must bury something, let it be my faults, my weaknesses, and all prejudice against my fellow man. Give my sins to the devil, give my soul to God. If by chance you wish to remember me, do it with a kind deed or word to someone who needs you. If you do all I have asked, I will live forever. This has been the famous essay to remember me, which has been quite potentially helpful to inspire and motivate people to pledge their organs. Likewise, life depends on heart. We all know life depends on liver. Let us all take care of our liver. Let us all pledge for organ donation. It's very important and has been the need of the hour. With this, I would like to end my presentation. This has been my team at Max Nanavati Hospital, and I thank you for giving me this opportunity as a proud member of Rotary Club International. Thank you very much.
Thank you so much, Dr. Hardik Shah, for a beautifully detailed presentation which even a layman could understand, and a very important subject. Now I open the forum for all the members to ask their respective questions for Dr. Hardik Shah.
Yeah. Thank you very much, Dr. Shah, for giving a very emotional as well as enlightening presentation. My question before I will open to the other members are two only. One is, how safe is liver transplant? I would not like to go for the controversy. Just I want to know, safe for the donor as well as for recipient.
All right. Thank you for the question. Very important question, because this is the first question that every patient and the family member asks. So, living donor liver transplant is very safe. 99% of the times, the donor does not have any concerns or side effects or complications following liver transplant. There are strict mandatory protocols and tests that I have just mentioned in my presentation. We make the donor go through all the tests. We have a joint discussion before we certify the donor to be fit for donation. Likewise, when we are discussing about liver transplant, donor safety is the priority, but likewise, the recipient's fitness for the donation or at the time of liver donation or liver transplant is very important. So we have our protocols fixed. Every center follows a protocol which is similar or rather same to ensure that the outcome of liver transplant remains successful.
Okay, thank you. Now, my next question is, there is a new weight management medicine injections which have been approved by the FDA for even for liver. Do you think by use of them, one can avoid the transplant?
Okay, so another interesting question. So we have weight control medicines in the form of Mounjaro, which is tirzepatide. Previously, we were using semaglutide. Now, these are weight control medicines that helps you overcome obesity and also helps you control diabetes. Now, with this, if you are able to achieve a good health, then your liver will not worsen to a stage of liver cirrhosis if the medications are started at the right time. So having said that, these medications cannot be given to a person who is already suffering from a end-stage liver disease, experiencing the complications of liver cirrhosis. These medications are to be given when the liver is probably in the fibrotic stage, so that we can control the fatty liver and it does not progress further going into cirrhosis. Likewise, there is another medicine that we have approved, or rather just been introduced in India. It is called Remash, or the name is resmetirom. This was approved in 2024 in the US. Now we are fortunate that the Indian companies are able to import them. Of course, the production is still not been licensed. Now, these medicines, if given in early stages of liver fibrosis, they have found to downstage or help the liver to get better from one stage of fibrosis to a stage below, which means that these medicines will help to control stages going into liver cirrhosis. Again,
Okay.
I would like to mark my words. In a patient with liver cirrhosis, suffering from end-stage liver disease, with complications of liver cirrhosis, these are not the candidates to take these weight control pills or resmetirom. These patients definitely require a new liver, and we always decide upon a liver transplant based on the MELD score. I did not take that into my description of the presentation, but the MELD score is a sophisticated standard score based on which we assess the liver function. And if the score is more than 15, we discuss the prospects for liver transplant. So the medications that we are fortunate to have in India now are to be given early in the stage before the patient reaches the end stage liver disease.
Okay, thank you, doctor. Now, I would like to ask Rotarian Rupa Arora if she's there. Rotarian Rupa Arora, are you there? Are you okay? She is a living liver donor. She donated her liver to her husband, Mr. P.K. Ratan, and the doctor signed and has done her surgery, their surgery. So, you have anything to say, Rotarian Rupa Arora? Please unmute yourself.
I think she would be the right person to moderate the entire session
No,
and give her
basically, she is our. We always have the policy of in our Rotary Club of Organ Donation International to make the living donor as an honorary member. Okay, and so she is our honorary member. Rotarian Rupa Arora, are you there? You are there, but I think some problem is there with you. This thing, so you will not be able to. Will you be able to do? Please unmute yourself. Time is short. I have to take questions from everyone.
यस गुड
Yeah,
इवनिंग सर
yeah.
सर ऐसी कोई प्रॉब्लम नहीं है लीवर डोनेट करके तो अगर मेरे को लगता है कि लीवर डोनेशन करने के बाद किसी की लाइफ सेव हो रही है तो इससे बड़ा कोई बात ही नहीं हो सकती है मैं बिल्कुल हेल्दी हूँ उसके बाद और आई एम आल्सो ब्लेस्ड विद द सन आफ्टर माय लीवर डोनेशन तो इट इज वेरी नॉर्मल प्रोसेस
well
Okay.
said. Thank you very much.
Thank you very much. Rotarian Sunil Gupta. Yes. He's a kidney recipient. His wife, she's also our honorary member. Rotarian Regina Gupta donated her kidney, and he is in San Jose. Yes, Rotarian Sunil Gupta.
Yeah, I want to first of all thank Dr. Hardik Shah for an enlightening talk and Rotarian Rupa Arora. It's amazing to wake up Sunday mornings here. It's a Sunday morning in the US to witness the miracle of saving life. What a beautiful message to start your week. One of the things I was going to ask Dr. Shah was, the consideration, since I am a kidney recipient myself, we focus a lot about saving lives, and that really translates only to the process of the surgical outcome, right? In your mind, what do you consider to be successful outcome in terms of I'm 14 plus years after my transplant, and obviously saving lives to me means saving life every day for, I'm looking selfishly talking, extension of life. What do you consider success for a transplant? Do you have data for recipients past 10, 15, 20 years?
Thank you for the question. So likewise, when we talk about data, the success of the transplant outcomes is based on survival more than 90% at 1 year and 5 years. This is what anybody would look forward. So if a person has lived beyond 5 years, then definitely it has been a tremendous success. Now, at our center, we are doing liver transplant almost 10 to 12 per month. Our team has been fortunate to do almost near around a good 5 to 600 transplants in past 7 to 8 years. And we have had more than 90% success rates. This is the standard protocol and the statistics all over the world that with the technical challenges overcome now with newer innovations and of course with robotic hepatectomy, the success rates have improved, and with the immunosuppressants that we give now post transplant, we have set protocols which we follow, following which the rejection rates and the infection rates have minimized, which has reduced the sufferings of the patients post transplant. So with advances in the science, we have been able to achieve tremendous success in liver transplant and likewise in other organ transplant, especially kidneys as well. I would not be having more data about heart and lung transplant, but I would like to restrict it to liver transplant, which has been my expertise.
Thank you very much. Okay. Anyone else wants to ask question related to liver transplant or something? Yes, Professor, Rotarian Professor Sudhir Saran.
Yes. Thank you, Dr. Hardik Shah, for a very enlightening presentation. And one thing I'm concerned about is what kind of diet and lifestyle habits adversely impact the liver health.
Okay. So again, it's a very simple question. I think you know the answer. Everyone knows the answer here. I would just like to kind of make it simple and short here. We all need to take care of our liver. And how do we do that? Well, alcohol needs to be in moderation. Now, there is no moderate amount or a safe limit for alcohol. When we talk about liver health, alcohol is the first thing that comes into our mind. People talk about 2 pegs, 3 pegs per day. Everyone has a different capacity to metabolize and tolerate alcohol. But if we are genuinely concerned about our liver health, I think we should minimize our alcohol consumption from negligible to nil. There is nothing called a safe limit. There is no concept of drinking in moderation. That's number one. Number two, when we talk about lifestyle measures, yes, lifestyle measures plays the cornerstone treatment in ensuring a good liver health. Why is that so? In today's era, we are all talking about obesity, fatty liver, and metabolic syndrome. This has had an impact on the liver health. If we do ultrasound in almost 100 people in a given day, 80% will have fatty liver. That has been the statistics now. How simply we can take care of it? We get indulged in routine activities, daily brisk walk, cycling, swimming. We control our calorie intake. We control our diabetes and cholesterol issues with the right full of medicines required at that given time. That will ensure that we lose weight, do not mount weight, and that will not lead on to increased fat burden on the liver, which will have adverse impact silently over the years. So losing weight is the key towards a good liver health. Third, science has proven that black coffee without sugar and without milk or cream has been proven beneficial for liver. So maybe if we are tea addicts or coffee addicts, we want to take care of our liver. 1 to 2 cups of black coffee per day, if we are able to enjoy, we should be adding it into our routine. Number 4, we should not fall for a lot of naturotherapy or naturopathies or herbal supplements or lot of stuff that we are commonly getting attracted to for liver health. Liver is capable enough to take care of its own, provided you keep it healthy. It is the most potent detox organ in the body. Then where is the question of going for detox therapy and detox diet or detox treatment? Just follow simple basic principles, healthy lifestyle, exercise, reducing weight, controlling diabetes, cholesterol, avoiding alcohol or minimizing its consumption, black coffee, and liver will remain healthy and happy for you.
Okay, thank you very much.
Thank you very much.
Rotarian Dr. PHF Dr. Rohan Monis, please.
Thank you, Dr. Shah. Beautiful presentation. And because this is on a live YouTube, I'm sure this will be a very good, very smart format for many listeners of us. My question to you was, with respect to liver donation, you said like the chance of failures are very high with respect to Ayurvedic supplements. Is that true?
I didn't get your question. You mentioned about liver donation and then you mentioned about Ayurved medicines.
I'm saying about with respect to liver failure, because see the commonest causes of toxins. One of the toxins we talk about is alcohol. What are the other toxins which are commonest in the list, so that our listeners will be aware of it?
So paracetamol, ratol, so yellow phosphorus or the rat poison can lead on to liver failure. Of course, when we subject ourselves for altered medications, may it be any herbal supplements or Ayurved medicines taken for some or the other reason, it has kind of upset the liver or trigger events in the liver leading on to liver failure. So during the COVID era, Giloy was the most sought after kada that we used to take to build up immunity against COVID. We as liver practitioners, we did find patients who had come in with hepatitis, subhepatic failure following excess consumption of Giloy. So likewise, when we talk about allopathy medicines, we know what the composition is and we always talk about its effects and side effects. So my simple message to you all would be, when we talk about any other supplements besides allopathy, we should know its composition. We should be sure about its effects and side effects. We should not blindly follow any other remedy just because it has been claimed or stated to be natural, because the composition many a times can be impure or mixed with lot of other elements which can adversely affect the liver metabolism leading on to liver failure. So
Okay,
be cautious when you are taking any other altered medicine. From my side, we usually ask them not to go for any such supplements. We keep ourselves healthy and fit. Liver will work well for you.
So
Thank you very much.
That,
Thank you very much, Dr. Shah, Dr. Monis. Two more people are asking, so I want to take, or you send me the WhatsApp, so I will forward to Rotary and Deepan Shah. Very, very short time, because time is the essence right now.
Yes, wonderful, Mr. Goyal. Wonderful, all fellow Rotarians.
Your question, please.
Yes, the question is hepatitis C. What I see, comparing with other countries, India has the highest number of hepatitis C, more than 5 million plus. And one of the reasons, what I understand, using the used needle is that's one of the primary cause for hepatitis C. And number two, people are taking heavy, water, heavy metals, even when they're making the rice and other grains. So that impacts on liver too. So any take on from you, sir, Dr. Shah?
Dr. Shah, I request for a brief reply,
I'll
please.
be brief on this. So hepatitis C, in past 2 decades, of course, we were struggling with medicines. Hepatitis C has been because of impure blood purification process before the 90s, but thankfully that is not the case now. We do have medicines which can clear off the hepatitis C virus. So if anyone has been diagnosed with hepatitis C, we have medications that can help you get rid of the virus before it is too late. So if you have been diagnosed with hepatitis C, kindly report to a liver specialist and take the needful treatment before it is too late. Likewise, the second question, you talk about the heavy metals. Yes. So anything in excess in the body, liver has to metabolize. So when it talks about heavy metals in any form or in any supplements, will have some effect on the liver, based on which the capacity of the liver, if it is exceeded beyond which it can be able to detoxify that liver, will have some effects and adverse outcomes.
Okay, thank you very much. Dr. Kamal Jain, please. Please unmute, Dr. Jain.
Dr. Hardik Shah, along with this alcohol and herbal medicines, self-medication is also very dangerous for any organs. Like, it can damage liver, kidney. So patient comes to us, for a backache. And that same prescription has been, after 5 years, even if we see he's, with that prescription, he's taking that whenever he is having the pain and painkiller. So that awareness is also important, I think.
Yes. So when we talk about other medicines, we are talking about especially TB medicines, which has been common in India, that tuberculosis patients are there and few TB medicines are notorious to cause liver failure. So whenever a patient is on anti-tubercular drugs, they need to watch over the liver functions. Definitely, there are certain antibiotics and painkillers which may be tolerated by few, but which may have adverse effects in few. So likewise, any doctor prescribing antibiotics or painkillers like brufen, aceclofenac, diclofenac, one needs to monitor the liver function alongside, which has not been the practice in real life situation. So I would request that any patients taking over-the-counter antibiotics from the chemist or painkillers, stop that, get to a good certified physician, and the physician's responsibility is to take care of the underlying liver function, because any small trigger can lead on to a hepatitis kind of a condition.
Thank you very much, Dr. Shah. Thank you very much. And over to you, Rotarian Ruby Agrawal.
Thank you so much, Dr. Hardik Shah. I request Rotarian Rupa Arora ji to give the vote of thanks.
Good evening, everyone. On behalf of Rotary Club of Organ Donation International, I extend my heartfelt gratitude to all who joined us today for this insightful session, Liver Transplant, a Medical Miracle. We are deeply grateful to Dr. Hardik S.R. Shah for sharing his knowledge on liver transplants and clearing so many doubts with such clarity. Your knowledge and experience have enlightened us all and strengthened our mission on spreading awareness about organ donation. Together, let us continue to inspire, educate, and save lives through organ donation. Thank you and have a wonderful evening.
Thank you very much. The privilege has been mine.
Thank you so much.
I